the porcine Wetlab. The main feature of Kitaro Wetlab is in the high-quality artificial cornea and artificial cataract lens with synthesized nucleus, cortex, anterior and posterior capsules. The setting: put tap water into the irrigation bag. Connect it with irrigation line of the phaco machine. Prepare a drainage box or some other drainage system and place the Kitaro on it. Take one artificial cataract lens from the 5-piece pack and set it in the hollow of the sclera part. Set the cornea iris part in the sclera part and cover it with a mask. Make side port incisions and a corneal incision. Fill the anterior chamber with viscoelastic. If you want to reduce the amount of viscoelastic, fill another chamber with water and put a small amount of viscoelastic on the anterior capsule. Continuous circular capsuloexis. Hydrodissection and hydrodelineation. Surface cortex aspiration. Grooving of the nucleus. What follows is a description of an artificial cataract lens with a soft nucleus. Beginners should start training for the grooving technique using a soft nucleus. Splitting of the nucleus into two halves. Rotation of the nucleus. Insertion of US tip into the half nucleus. Holding of the nucleus and splitting of the nucleus into quadrants. Emulsification and aspiration of the nucleus fractions. Removal of the cortex with IA tip. IOL implantation. As we have demonstrated, you can practice phacosurgery very similarly on the human eye. Following is a description of an artificial cataract lens with a medium hardness nucleus. Grooving of the nucleus. Splitting of the nucleus into two. Rotation of the nucleus. Insertion of US tip and holding of the nucleus. Splitting of the nucleus into quadrants. Emulsification and aspiration of the nuclear fractions. Removal of the epinucleus. You can practice all phacosurgery steps very similarly on the human eye. This is nucleus segmentation with the pre-chop technique using the soft nucleus. This is a method to practice the phaco chop technique using the medium hardness nucleus. First chop. Second chop. In this case, posterior capsule tear occurred and the fragment almost dropped into the vitreous cavity. However, you can learn how to manage posterior capsule rupture. First, extend the incision and remove the fragment with a vectus. Perform 2-port vitrectomy to practice removal of the residual cortex. Then, suture the incision. As we have shown,